We're back with Chapter 1, Part 2, and we're going to talk primarily through this section about cancer. So let's get started. Cancer is a group of diseases characterized by uncontrolled cell proliferation, and this leads to the development of neoplasms, growing masses of abnormal cells that proliferate at the expense of healthy organisms. So proliferate means that they multiply or they grow very rapidly. Tumor characterization. Tumors can be either malignant or benign, and it's going to depend on the cell type and tissue of origin. So a note here, some of the main general types of cancer are carcinoma, cancer of the epithelial cells, sarcoma, which is cancer of the supportive tissues of the body, such as bone and muscle, lymphoma, which is a cancer arising in the lymph nodes and tissues of the immune system, and then leukemia, which is a cancer of the blood cell precursors, and lastly, melanoma, which is a cancer of the melanin-producing cells of the body. If you want to briefly refer to Table 1-2 on page 10 and Table 1-3 on page 11, that gives you a good amount of information there. So let's start with talking about benign tumors. So these benign tumors develop slowly. They can come from any tissue, which means that they can develop in any tissue in the body. They resemble the tissue of origin, which means if they arise from the liver, they resemble liver tissue. If they arise in the intestines, they resemble intestinal tissue. If they arise in the ovary, these tumors will resemble ovarian tissue. They will rarely recur after surgical removal, which means that once you take them out, the chances are pretty good that they won't come back. Because these tumors take up space, complications can result from compression of tissue by the lesion or the obstruction of organs. So even though these are not cancerous tumors, they can cause problems within the body system if they get too big. The more serious type are malignant tumors, and those cells are variable in appearance, and they are very disorderly. They do not behave well. They have the ability to invade other tissues. Metastasis makes the neoplasm much more difficult to eradicate. And so what happens with these cells is that they don't necessarily take on the tissue type that they arise from. They are different in their appearance. They do not stay within that one tissue. They metastasize, which means that they spread to other tissues and then take the cancer with them, obviously, to those other tissues. So malignant tumors can represent a serious threat to the health and life and well-being of a person. Often, malignant cells enter the bloodstream or the lymphatic vessels, and then that will lead to tumor growth in other areas of the body. So if you start cancer cells, if cancer cells arise, or a malignant tumor arises out of the ovaries, and then the cells from that get into the bloodstream or into the lymphatic stream, then that can take those cells, to different tissues of the body, and that's how metastasis happens. Cancer cases and death, a couple of things that you will notice as we go through these lectures going forward that I very rarely leave the graphics in the lectures, just because they take up a lot of space and time. But this is one that I left in because I wanted you to note that for new cases and deaths, new cases of men's prostate cancer, it has risen dramatically, and so these are 2015 estimates, so these are pretty recent. And then breast cancer for women. Now that's not super surprising, but what is surprising is that despite breast and prostate cancer, which are both reproductive cancers, well, the prostate gland is in with the male reproductive organs, kind of, in a way, but when you look at the new cases being reproductive cancers, the top cause of death, cancer-related deaths, still remain lung and bronchus for both male and female, and they are pretty neck and neck, with females edging out the males just a little bit. So if you look at these numbers here for new cases of prostate and breast cancer, those are the highest amount of new cases. They run a very distant second to the deaths of lung and bronchial cancers. So just something I found kind of interesting. Okay, so cancer prevention, everybody wants to prevent cancer. The diagnosis of cancer is very prevalent in U.S. society, which means that the odds are pretty good that somebody you know, if not yourself, has been touched by cancer in some way. So in order to try to prevent that from happening, prevent cancers from happening, we want to encourage people to consume a diet rich in fruits, vegetables, and whole grains, eliminate active and passive exposure to cigarette smoke, limit skin exposure to sunlight, so make sure you wear proper amounts of sunblock. That's definitely important in California where the sun is scorching and near constant in the summer months. And then also limit the use of alcohol and avoid excessive exposure to radiation and radon. We also can avoid chemical agents known to be carcinogenic. This is the cool thing about California. Like I mentioned in the last little segment of the lecture, I moved from Indiana recently, and there are no warning labels on anything. But when we moved here, one of the very first things I noticed was in a restaurant. We drove into California and we were starving because we've been driving all day, and so we stopped at a restaurant to eat. And the very first thing I noticed in the very first restaurant I ever stepped foot into in California was a sign that was up in the ordering area talking about the various carcinogens that were known to the state of California to be present in that facility. So I thought that was kind of cool. I mean, that's a really nice public health, I guess, announcement or practice to let people know what carcinogens may be present in that facility. So then, if you know, you have the ability to avoid those if you want to. You can choose to walk out of that restaurant and go someplace else if you want to. In many, many states, that's not an option. People don't know. So they just kind of partake in these things and then, don't ever really know what it is that they could be exposed to. So that eliminates their ability to make a decision to avoid those. All right, so also increased physical activity, maintain a healthy weight, and protect against STIs, which are sexually transmitted infections, including getting the HPV vaccination. Statistics from the American Cancer Society estimate that nearly 1.6 million Americans are diagnosed with invasive cancer, and more than 500,000 of those die every year of cancer. That's a scary, staggering number. 1 out of every 4 deaths in the United States is cancer related. Also a very scary statistic. So the ways that we screen for cancer, treatment will be more likely to be successful if the cancer is detected early. So screening exams can detect cancers of the breast, rectum, colon, prostate, cervix, testes, oral cavity, and skin. You may have already had some of these screening tests that you may not realize were actually screening for certain types of cancer. So if you are a woman and you have had a pap smear and a prostate, I hope you're not a woman with a prostate, but if you have had a pap smear and a pelvic exam, then you have already been screened for cervical cancer. So that's there's all these different types of screening places or screening tests that are in place to help us quickly identify the presence or absence of potential cancer cells. So if cancer is suspected, additional diagnostic investigation is achieved by using high technology imaging techniques and most decisively by obtaining a biopsy of the lesion. So they're going to go in and cut out a section that they think is cancerous and then take it to the lab and run it through histology and pathology and see if it actually is cancerous. You may also be able to detect certain types of cancer by the elevation of blood serum and tumor markers. And this helps determine the diagnosis of cancer, evaluates responses to therapy, and then can also screen for disease recurrence. So there's stages of cancer that you have to be aware of. TNM staging system, it involves the size and extent of the primary tumor. So the stage reflects the tumor size and the extent of tumor spread and has important implications for the prognosis and in the determination of treatment and choice. The extent of regional lymph node involvement by the tumor is factored into the TNM staging system, as well as the number of distant metastases. So how many off-location sites has that cancer spread to? If the cancer started in the cervix, how many other places away from the cervix has that metastasized to? So stage 1 is the best prognosis. Stage 4 is the most advanced. Staging is a terminology that institutions can use to communicate patient information, so the procedures and staging systems used for staging must be standardized worldwide. So that means that if you have a patient who is getting treatment in California, and then their doctors have determined that they are a stage 3 in California, they will still be a stage 3 in Florida, in China, and Australia. It's a universal, worldwide standardized staging scale. So once all three parameters are defined, they are combined to assign a stage number of 1, 2, 3, or 4 to the cancer. There's a table on page 14 that you can definitely check out. I would recommend that you check that out so that you can see more information on the staging. Okay, so other factors can affect prognosis as well. Factors such as age, serum concentration, which is part of the blood, the liquid portion of the blood, time between diagnosis and treatment. So the prognosis is going to reflect the estimation of the likelihood of cancer reoccurrence and death, independent of the treatment given. So that means that it's the estimation. They are trying to figure out how likely it is for this patient's cancer to come back or for them to die, independent of the treatment that they are going to be given to stop that from happening. In general, the diagnosis of cancer in an early stage offers a much greater chance for a cure. So talking about different treatments for cancer, treatment options are going to involve localized therapy such as surgery and radiation, along with systemic modalities such as chemotherapy, hormone therapy, and immunotherapy if necessary. Surgery is a cancer treatment option. When we're looking at surgery, it's employed as a curative measure, which means that surgeons try to achieve negative margins around the tumor, meaning that the surgeon will remove a certain amount of normal tissue along with the tumor to ensure that the entire tumor has been removed. Palliation of surgery is performed to relieve troublesome symptoms such as an obstruction. Chemotherapy is usually given in cycles that include a treatment period followed by a recovery period. This also involves the use of medicines to destroy cancer cells. Most of the drugs affect cell replication, and that means that chemotherapy is most effective against rapidly dividing cells such as cancer cells. So chemo is nasty stuff. It has a whole lot of negative side effects that are associated with it, but it is effective a lot of the time at killing cancer cells. Hormone therapy is another treatment option, and it can be effective in hormone-dependent cancers such as breast cancer and prostate cancer. It may involve the administration of drugs that suppress hormone synthesis. And then lastly, we have immunotherapy, which stimulates the body to fight cancer. Okay, so there are some consequences that go along with cancer therapies. Chemo and radiation are very toxic to the body, like I just mentioned. Patients are predisposed to other malignancies, which means that they are at a higher risk to develop other cancers. The effects are dramatic in children. The effects of cancer therapy are very dramatic in children. They often will experience growth retardation and cognitive impairment, and that's pretty common. Cancer therapies are constantly evolving. There's SRS, which is stereotactic radiosurgery, and that has been available for several years as an alternative to conventional radiation therapy. So a couple of notes I want you to know or be aware of here. While traditional therapy involves giving small doses of radiation with a single beam for many cycles, SRS involves many beams of low-dose radiation coming in at different angles, and they all converge on one point so that the target tumor will get a very intense amount of radiation. But the normal tissue each single beam passes through gets only a small amount. So in some treatments that is more advantageous than the conventional way of using a single beam with radiation therapy. So the advantages of SRS over RT are that the normal tissues experience much less toxicity. Usually only one or a few treatments are required with a short or no recovery time. If you know anybody who's had traditional radiation therapy, you know that recovery can be a few days, sometimes even a couple of weeks, because it makes them incredibly sick. So that's nice with SRS. There's much less recovery time. Cancer vaccines. So regarding cancer vaccines, there's research that's currently underway to produce vaccines that may treat cancer in patients who already have the disease. So what happens is these vaccines are aimed to isolate proteins from cancer cells that can trigger an immune response in the patient to attack and destroy the cancer cells that are hanging out in there. They inject a substance that will cause a generalized immune response to destroy that tumor tissue. So my note here, there are many cancer vaccines in clinical trials, and there's even one that has received FDA approval for use in patients with metastatic hormone refractory prostate cancer who are minimally symptomatic. And the Sipuleucel T is the excuse me, generic name, and then Provenge is the actual brand name of the vaccination. So there is one. It is for a very specific type of prostate cancer and only can be used in patients who have very few symptoms. So usually somebody who's been caught very early. Okay, so hospice care includes a compassionate staff that has pledged to respect the patient's choice for care and to provide comfort, dignity, and privacy. It focuses on comfort and support for the family, and it neither hastens nor postpones the death, which means that it doesn't speed up the death, but it's not taking extensive life-saving measures either. So patients and family may attain a degree of mental and spiritual preparation for the death if they have their patients in hospice care or their family members in hospice care. And a full range of care in a variety of settings can be provided through hospice. So my notes here that I would like for you to remember: terminally ill persons can be referred to hospice care for compassionate, holistic case management. Hospice care is covered by health insurance if a patient has a terminal illness and a physician certifies that the patient likely has less than 6 months of life remaining, although the amount covered may vary by insurer. So one of the basic criteria to get into hospice care is for the patient to be expected to live less than 6 months. Typically, it's far less than 6 months. And many insurances have very specific hospice care policies. So if you ever decide to take my health insurance class, then you will learn much more about hospice care there. All right, so that's the end of chapter 1, part 2, and we will pick up with part 3 here shortly.